Dr. Anthony.
Hello.
Thank you so much for inviting us here to see behind the scenes at Pallotto Dental Care. Well, thanks so much. You know, I understand that it's important for people to come and have preventive care at the dentist about every 6 months, right?
That is correct.
And so why is that so important?
Well, you know, it's important for a lot of reasons. Specifically, periodontal health is what deteriorates first. In 6 months, it's a good time to come in and check on the status of the periodontal health. If we don't do that, things tend to, plaque accumulates, and it's just more difficult to remove that plaque after those 6 months. So if you come in earlier, it makes procedures easier on the patient, faster for the patient, and it's just a chance for us to check up on the teeth as well. You don't just focus on the gums, but you look at the whole scenario. Okay.
The whole practice here at Pallotto Dental, preventive care and other services as well, has been going on for quite some time. In fact, I believe you are the third generation, right?
I am.
So you have your dad, Dr. Nick, and?
Right, and my grandfather, 1946 in South Chicago, he started the practice.
Okay, 1946. That's a long time ago, and you're continuing a wonderful tradition.
Thank you.
That's great. I understand also that, Dr. Anthony, you have a specialty in restorative work. Explain what that is to us.
Right. So I completed my dental training in New York at NYU. And after that, right now I'm in 3 years of training at UIC, University of Illinois, Chicago. And I decided to focus mostly on the restorative end, so replacing missing teeth with implants specifically, but also more traditional approaches like bridges, crowns, even dentures and partials. So it's very exciting and fulfilling to be able to do that.
It is, because it helps people gain back that self-confidence, especially if they've lost quite a few teeth.
Absolutely.
Is it normal in the course of a lifetime for someone to actually lose a tooth completely?
In fact, it is. Most people that you know will be missing at least one tooth. I believe the statistic is about 75 to 80% of people have at least one tooth gone, and that's not including wisdom teeth. So, the treatments vary based on what's missing and what the impact is on the person's life. But, we can treat those teeth and missing teeth in a variety of ways. So,
that's helpful to know, and it's also good to know that you're right here in Lansing, so it's not far away, that we can come get that very helpful service.
Right.
Also, I'd just like to ask about getting these things done. They seem to be kind of a big deal. People can get nervous about going to the dentist anyway. Not just about being in the chair, but about the cost. So tell us a little bit about how people deal with the rising cost of, say, the implants and that kind of work.
So each procedure has a lot of options. So implants can be combined with more traditional approaches. So even if a patient's missing all of their teeth, say, one option may be to replace them all with implants, but that's not always needed. You can combine removable approaches with the implants to cut down on the cost a little bit, and the ease of the procedure for the patient. Sometimes a lot of chair time is required for these longer procedures, and patients just don't have time for that. So we can kind of tailor the plan to fit what's going to be best for the patient.
I understand that Dr. Nick is here too today, and we appreciate you sharing your specialty with us. We'd like to talk to Dr. Nick and find out about some other services here at Pallotto Dental.
That sounds great.
Well, let's go see Dr. Nick.
All righty.
Hi, Dr. Nick.
Good morning, Renee. How are you?
I'm fine. Thanks so much for meeting us here in one of the exam rooms. I'd like to ask you a few questions. Dr. Anthony told us about his specialty, restorative work. And this practice here at Pallotto Dental offers so many options in terms of service and products. Can you tell us just a little bit about when a patient comes in, how you advise them on choosing services and options in products, preventive care as well as restorative care? How do you counsel a patient?
Well, when we have a patient come in, they're scheduled for a complete exam. And depending on their age, we may suggest what's called a Panorex. Basically, that's looking for pictures of the entire jaw. And again, depending on their age, if they have wisdom teeth, it shows wisdom teeth much better than what's called the full mouth series, where they're small individual films. Then we will go ahead and advise them what type of hygiene appointment they might need. If they have signs of gum disease, it's a little more involved. If they don't, it's pretty basic. And then we'll go ahead and chart and see which teeth are there, which teeth aren't there, which teeth might need a restoration. And then we'll talk about what the patient really wants, because what I see might be entirely different than what they perceive and what they want. So then, there's a dialogue, there's a feedback between the patient and myself, or Dr. Josephine or Dr. Anthony. Mm-hmm. And then we'll discuss, what their desires are, what we think we can do for them, and come to a treatment plan of what may work for them. Sometimes what they want to do isn't exactly as easy as they may think it is, or maybe it's not as doable as they think it is, and so there's a discussion there.
In terms of the services that you offer outside, I noticed that there is a sign advertising Invisalign. Mm-hmm. What is Invisalign?
Invisalign is a dental treatment, dental product that can straighten teeth, and it works very nice in situations where it is effective. Mm-hmm. It's not effective for all tooth movements, although Invisalign may not agree with that. My personal opinion is it's not effective for all movements, but basically it's a series of aligners. They call them aligners. Mm-hmm. They're flexible. They're made of an acrylic or a plastic.
Can I feel that?
Sure. And you wear each aligner for 2 to 3 weeks. You wear 24 hours a day. You only take it out to brush your teeth and to eat. There's a good side and a bad side to this system. The good side is you can barely see it. It's removable. You can brush your teeth. You can eat. But compliance is a very big factor. If you don't wear them, they don't work.
So a certain number of hours a day, you have to have this on the teeth in order for that to really work in straightening and moving them around.
Correct. You have to, and you wear them top and bottom. Mm-hmm. Some treatment will range from 12 aligners, maybe all the way up to 28 aligners. So it's not a shortcut compared to conventional braces. Mm-hmm. You still have to wear them. It still takes time, but it is a nice way to go for cosmetic purposes and for hygiene. So and it's a great thing. People really like it, but compliance is the key. You don't wear them, they won't work.
If you could advise people with one piece of advice, as a dentist who's been in practice all of these years, yeah, what would that one piece of advice be?
I have to go back to diet and home care.
Okay. Because
so much of it goes back to that. Because you could spend a lot of time, a lot of money restoring your teeth, mm-hmm. Taking care of your cavities. But as soon as you leave, the process can start all over again. If you have a high sugar diet, bad home care, it's all going to start all over again. It never ends. It's a never-ending thing.
Consistency, a little bit of discipline, and coming to see Dr. Nick, Dr. Anthony, and Dr. Josephine, right?
That's right.
Okay. Thanks so much for allowing us to come see behind the scenes.
Thank you.
And get just an overview of how wonderful this Pallotto dental care is right here in Lansing.
Thank you.
And it's all for us, and we appreciate you very much.
We appreciate you being here.
Okay. We've had a great time getting to know Pallotto Dental Care today. They're open for business. I'm Renee Hale, and I'll see you next time.